Forget New Year, New You. This season is about slowing down, locking the doors, and cozying up at home with the one you really want to do nothing with. Your dog. After the holiday chaos, those quiet nights with a blanket, a podcast, and your pup feel like the reset you actually need. Ollie helps make those moments easier with fresh protein-packed meals made from real human-grade ingredients, so your dog can enjoy some quality comfort food too. Choose from 5 recipes and get a personalized plan for your dog's needs. Meals arrive perfectly proportioned with a scoop and storage container, so serving is fast and mess-free. And with Ollie's in-app on-demand health screenings, supporting your dog is easy, ensuring more cuddles for many years to come. Visit ollie.com/truecrime and use code TRUECRIME for 60% off your first box.
If you watched the documentary Take Care of Maya on Netflix, then you've heard the tragic story of the Kowalski family. 10-year-old Maya Kowalski had been diagnosed with a rare chronic condition that left her in excruciating pain. It tore her family apart watching Maya suffer. Maya, once a competitive figure skater and gymnast, couldn't walk anymore and needed a wheelchair. She screamed throughout the night from the intense burning pain. Her parents tried everything they could to ease the pain. She went to physical therapies and saw multiple doctors. It took a long time for Maya to get a diagnosis for her mysterious illness, complex regional pain syndrome, or CRPS. Nothing helped, so at the suggestion of one of her doctors, her family tried an outside-the-box, unorthodox treatment of high doses of ketamine, which, according to the DEA's website, is a dissociative anesthetic that has some hallucinogenic effects. At one point, in October 2016, Maya went to the ER due to serious constipation connected to her CRPS. She was admitted into the Johns Hopkins All-Children's Hospital in St. Petersburg, Florida. While there, her mother, Beata Kowalski, demanded that Maya get higher doses of ketamine because of her intense pain. Such an unusual request raised red flags in the hospital, and that set into play a series of events that changed the family's lives forever. According to the Kowalski's attorney, All Children's Hospital didn't believe that Maya was in pain and couldn't get up from her bed. Maya's parents were accused of Munchausen by proxy syndrome and of intentionally causing Maya's sickness.
There's no question that they tried to change the narrative here. And walking in as a normal family with a child with a debilitating disease, they walked out suddenly with Beata as the enemy and Maya as a liar. That Maya was making all of this up and that Beata was somehow encouraging it.
Maya's family was temporarily broken up by a court order. She was taken out from her parents' care and became an involuntary medical ward of the state. A judge ordered her to remain at the hospital, and her mother, Beata, couldn't see her for 87 days. Those medical child abuse allegations were serious for Beata, who worked as a nurse for a living and knew that they could destroy her career. Beata also feared Maya was getting sicker in the hospital without her. Her anxiety intensified. And that's when this story takes an even more tragic turn. Beata died by suicide in her garage.
Beata Kowalski gave her life for her child because she knew Beata was prescient. She knew something was going on in that hospital, and she had been told repeatedly about how her daughter was suffering.
6 days after Beata's death, Maya was returned back to her father's care. Maya's father, Jack Kowalski, sued the hospital for $220 million over allegations of false imprisonment, battery, intentional infliction of emotional distress, medical negligence, negligent infliction of emotional distress, negligent training of doctors and healthcare providers, and fraud. On the other side of the civil lawsuit, the hospital's attorney, Ethan Shapiro, defended Maya's hospital caregivers, and insisted the Kowalskis had subjected their daughter to dangerous and unnecessary drugs. He argued that All Children's was a mandatory reporter for child abuse and said the hospital could have settled the lawsuit, but decided to take it to trial in order to stand up for the hospital and staff. The reason why All Children's decided to take this case to trial was because, unfortunately, this case has caused a deep, chilling effect in mandatory reporting throughout the country, and All Children's is here standing up for mandatory reporters, Shapiro told Fox 13 Tampa Bay. And so the showdown between the Kowalskis and All Children's Hospital went head-to-head this last fall during a high-profile 5-week trial. And that's what we're covering in today's episode. This is Jillian in partnership with Law and Crime. You are listening to Court Junkie, episode 265. I want to cut right to the 11th day of trial, which is somewhat out of the ordinary for how we usually cover trials.
Please state your name for the record.
Maya Kowalski.
I want to start with the words of Maya Kowalski, now 17 years old, who took the stand to testify about her life, which was at the center of the lawsuit. Originally from the Midwest, Maya's parents, Beata and Jack Kowalski, moved to Florida to start their family. By then, Jack was retired from his nearly 30 years in the fire department. Beata still worked as an infusion nurse. The Kowalski family lived in Venice, Florida, a small city in Sarasota County about a 35-minute drive from Siesta Key. Maya was the middle child. She had an older sister and a younger brother. With a small frame, she was an excellent gymnast and figure skater. Maya's testimony made it clear that she loved her family, and she was also tough. She once broke her arm on a fall off her bike, and no one knew for 3 days because she didn't cry. She simply stood up after the crash and rode home. She later told her dad that her arm hurt. "I've always had a high pain tolerance," Maya testified. She explained how she got sick.
Well, the jury needs to know how this came on. You just wake up one morning and bang, you were in extreme pain? Or how did it start?
It wasn't like that. It was pretty gradual, but not in the sense that it took like 3 months until I had excruciating pain. It was day by day I noticed that there was a pain in my right leg that was just getting worse and worse.
So it started in your right leg?
Yes.
And did it stay in your right leg or move?
Unfortunately, it did move because I wasn't diagnosed for quite some time.
The pain spread. Once you're in pain, it's just so hard to stay quiet, Maya testified, as jurors saw photos of her lying in a hospital bed or smiling weakly in a wheelchair as the pain spread from her legs to her midsection. It affected her digestion and made her dangerously constipated. At one point, she was hospitalized for a month at a time. Her parents, of course, stayed with her then.
At this point, did you know what was really causing your pain?
No one knew.
And what was the effect on your mom and dad not knowing? Here you are a month or so after it manifested, it came on. How did it affect them?
Well, my parents were extremely worried. And in turn, that made me more anxious because as a kid, you look up to your parents for the answers. And then when they look up to the doctors for the answers and they don't even have them, you're just so unbelievably anxious.
A machine was used to try and strengthen her leg muscles at one point. Jurors saw a photo of Maya working out during physical therapy.
What's that on your feet? What are you doing there?
So that machine is for pedaling, again, just in hopes of strengthening my leg muscles.
Right. Now, at this point, a couple months maybe past when it came on, looks like you still have some pretty good muscle mass in your legs.
Yes, and then I don't know if you could really tell, but you could see that my dystonia is starting to get worse.
Uh-huh. That means your toes pointing in?
Correct.
Tell the jury about that. There were allegations that you somehow made this up. Did you have any control over your feet when they started to go into that position?
I had absolutely no control over that.
What did it feel like when they began turning in?
It was extremely painful, and it was like tense, if that makes sense.
Maya's attorney asked her to identify one of the nurses with her in the photo.
Who's that person behind you?
That is Bonnie Rice. I kind of call her like the Kathy Beatty of Tampa General. She was a nurse, but overstepped in many ways.
So she followed you around?
Yes.
And she wasn't quite as nice as Marissa?
Definitely not.
Why did they have a nurse following you around everywhere?
Subject to the situation, Your Honor.
She knows.
Sustain once you re-ask.
What, if anything, do you know about why Bonnie Rice was following you around here?
I had the understanding that Bonnie Rice, even though she was a nurse, she believed that I had either conversion disorder, so I was like making up my disease. I don't know what child would want to pretend not being able to walk and not being able to play with their friends, but she drew that conclusion. She also had some problems with my mom because she expressed these concerns to my mom. My mom knew I was not making this up. She knew her daughter.
Jurors saw a photo of an open red sore on Maya's cheek, a lesion that was one of the symptoms of CRPS. The sores were painful. Maya was also sensitive to temperatures, to touch, to light. She testified that one doctor wanted her to have a surgery to break her feet so they would straighten out. The doctor later denied he said that, according to court testimony. Maya told the court that her symptoms changed constantly, so every day she could feel a little different. She said she felt isolated from the rest of the world.
And so for you, was it difficult to see the other kids outside playing and you in the wheelchair?
Yes, very much so. There was actually one day I was invited to the YMCA, which is where I used to do gymnastics. And I was wheelchair bound at the time. And I never went back to watch them because it just ate me up.
Do you want to get out of that wheelchair?
Yes.
Maya described all the treatments they tried as she lived with her pain.
Had you had physical therapy so far?
Yes.
By this point? Had you had, I guess, occupational therapy, upper body stuff?
Yes.
And had you had some psychological evaluations?
Yes, I had counseling.
And did you then have warm water therapy?
Yes.
And what kind of meds had they put you on up to this point of the ketamine? What were you taking?
I'm going to be honest, I was, again, like really young, so I didn't ask what medication I was taking. But it's my understanding I did try some prescribed opioids from my doctors.
Remember anything about whether they worked or not?
They didn't.
After trying all of that, the family turned to ketamine.
Tell the jury how that went.
The ketamine infusion?
Mm-hmm. Yes.
So,
have we put in 252942? Is that already up? All right. Go ahead and explain what.
So the ketamine infusions were very different than anything I had tried previously. It's this like really small room with a bunch of different equipment and then a nice soft bed. And then super adjacent to the bed is like a little TV so the patients can watch whatever they want while they're getting the infusion. I slept for most of it, so I don't really know the duration of the whole treatment, but I know it was over the course of a few days.
Well, you said you slept during most of it. How were you sleeping at night at this point?
Oh, I was not sleeping. It's very difficult to sleep when, you're having excruciating pain and pain that you've never felt before.
And so even with your high pain tolerance, describe for the jury as best you can so they can understand what it's like, the CRPS pain.
How I describe it to people who don't have CRPS, it's like I was born with gasoline deep within my body, and some incident, whether it was that sprained ankle or the severe asthma attack, was like a match and acted as a catalyst that just set my body on fire, and I have to live with this burning pain.
The Kowalski family heard Maya's screams at night. Her brother, Kyle, slept in the bedroom right next to hers. Beata and Jack took turns caring for their daughter. Here's Jack Kowalski's testimony.
I want to talk for a moment about Maya's pain. And I want you to tell the jury how you know when your daughter's in pain.
Being in the house and hearing your kid screaming 24/7, there's nothing that we could do.
Was this every night at this point?
It was mostly throughout the day and night. After hearing that, Bonnie Rice saying it's conversion disorder, this child was screaming and crying. If she took a shower, the droplets of the water would make her scream. You put a sheet over her legs, she would scream. She had to be assisted on the toilet, and she would scream. She'd look out the window, see her friends playing, and you knew that she's not faking this. Did I ever think she was faking at first? It was like a light switch where, all of a sudden everything changed. It's like, it is just so unbelievable that something could happen that quick.
Are there days when she doesn't look like she's having pain, but she is?
Yes. And in fact, we were in church several times where we had to leave. It bothered her that much.
Jack was asked what he noticed about the doctors whenever he brought up the pain Maya was having. He said they never had any answers for them. He was asked if they appeared to be frustrated.
I said before, the doctor holding her hands up and saying, we don't know what it is, but we could give pain medication.
Was that concerning to you?
It was very concerning, and that's why we left.
Did you want your
daughter?
Did you want your daughter on opioids, or did you not want your daughter?
No,
on
we want whatever's wrong with her taken care of correctly.
All right, then. So I want you to then, considering the PT and opiate therapy to this point, I want you to explain to the jury when and how you learned about ketamine.
That was with the consultation with Dr. Anthony Kirkpatrick in Tampa.
And if you recall, what did he tell you about that?
He explained the procedure. He talked about, it's been around for quite a long time. He mentioned that it's used for many things. It's safe. There is the side effect when they're coming out of it is a hallucination for a short period of time, but then they come, everything's back to normal.
Did he explain that was generally controlled by another med like Presidex or others?
Overruled on that one.
Did he explain at that time that hallucinations could be suppressed or controlled with the use of other medications?
I don't recall, to be honest with you.
Well, that's
he did give us a website to look at also and then other literature. Once again, I wouldn't expect Beata to go put out a house fire, and I don't want to be a nurse, so
right.
That was in her part.
So how is this affecting Beata now before Dr. Kirkpatrick? Was there what was her sense about it?
Beata was looking for the answer. She knew there was nothing wrong with Maya's head. Your child. The child's not going to all of a sudden just decide I'm going to fake this and not play with my friends outside and, just sit around and watch your body deteriorate. Along with that, you don't put lesions on your body by yourself as well.
When do those start?
I don't recall exactly when, but that was another sign of the CRPS.
He said they went forward with the ketamine treatment.
Tell us how that went.
Originally, he told us how it's going to be. She's going to get the treatment. She will hallucinate during that time. Sometimes some patient may do better than others.
Mm-hmm.
We did see some improvement, but unfortunately it wasn't the lucky one to have better improvements.
Did the symptoms reduce in any way, or was this?
Yes, they did, and I forgot how many treatments she had. I honestly don't remember, but it did help. And we did, you know what, it was, here we're on that roller coaster, and finally we're climbing up and feeling good. But then, unfortunately, at some time, we took that big dip again.
Beata Kowalski was a force of nature, the quarterback of the team, a lioness, her family's attorney said. And Beata was looking for answers to help her daughter. The Kowalskis decided Maya should go to Mexico for higher doses of ketamine to see if that would make a difference.
I had a discussion with Dr. Kirkpatrick first. He explained some of the risks associated with the ketamine-induced sedation, the prolonged sedation. And then when I went to Monterrey, Mexico, I was then again told about the risks.
And how did it strike you? I know you were only, had you turned 10, I guess, by this point?
Yes, in December.
Yeah, because your birthday is when in?
December 10th.
Okay. So what was your reaction, from what you recall on your age at that time, to hearing that there were some possible complications, some possible risks with this procedure?
Well, I was presented with the worst case scenario, which was a 50% chance of death. Even though that's not completely true, they always give you the worst case scenario just in case something bad happens.
Had you heard that with other medications and things?
Yeah, I mean, every medication has like a ton of side effects. But you know it's bad when like a 10-year-old is willing to take that risk. I mean, that's how bad my pain was.
Maya's doctor, Dr. Anthony Kirkpatrick, testified that he had diagnosed Maya with a bad case of CRPS and that she needed the ketamine treatments in order to do everyday basic things like feed herself and brush her hair. In fact, he told the jury that he had told Maya's parents that if she didn't get the treatments, she would have suffered a slow, painful death. After the heavy doses of ketamine, Maya seemed to be faring better. Her feet looked straighter. She smiled widely in photos with her family by a Christmas tree. She swam in a pool. A video showed her dancing as best as she could in her wheelchair to her favorite singer, Meghan Trainor. Maya was on the path to eventually walking again, although her legs weren't yet strong enough. She testified that she didn't go back to school because she didn't want to be the only kid in a wheelchair. At home, Beata gave her ketamine treatments that had been okayed by her doctor. She mixed ketamine with Gatorade so Maya could drink it. Eventually, though, the pain was back.
With CRPS, it's pretty well known that it could affect some organs, and for me, it affected my large intestine, so I often got pretty constipated. It's because both, CRPS, it's an attack on the sympathetic nervous system, which also affects the digestive system, so I was pretty constipated regularly.
In October 2016, Maya was in excruciating stomach pain from being constipated. She went to the ER and then was transferred to the Pediatric Intensive Care Unit, or PICU, at Johns Hopkins All Children's Hospital. Not only was Maya's pain back, but so were her lesions, sensitivity to temperatures, and contracting muscles in her legs. Then the family's nightmare deepened.
The last time I saw my mom, my dad wasn't there. I was laying in the bed.
This was while you're in your room. Did you go back
Still
up?
in the PICU.
Still in the PICU?
Still in the PICU, yes.
So this is pretty close to when you checked in?
Yes, yes. I know I was still in the PICU. My mom was like picking up her work bag and just like little things she had brought to the hospital, and she said, "I love you and I'll see you tomorrow." And I never saw her again.
I'll be back with more court testimony right after this quick break from our sponsors. Dr. Beatriz Tepa Sanchez, a critical care physician at All Children's Hospital, had recently started working there when Maya Kowalski was brought in. Dr. Tepa Sanchez, who is board certified in pediatrics and pediatric critical care medicine, testified for the defense about what it was like when Maya first arrived on October 7th, 2016.
At that moment, I recall the nurses were, as their usual practice, putting the stickers for the monitors, checking the IV. That's our usual practice, getting another weight on our patient and things like that. But it was very chaotic at the time. There was, the nurses were trying to put their stickers and put it on the monitors. And there was just a lot of very loud environment and a lot of screaming. So my initial encounter was to just try to calm everything and try to take what I was seeing and see if I needed to do something right and then, or if the patient needed anything. I needed vital signs. I needed to make sure I could examine her. So there was a lot of screaming from Maya, and then there was a lot of kind of loud discussions between mom and the nurses.
Okay. And what was the source of all the hubbub, if I can use that?
Sure. I think at that moment, as the nurses were trying to put the monitors in Maya, the concern was that she was in pain, and that everything that was being done was causing pain. So Maya was saying that, she was hurting and there was a lot of pain, that she needed her anesthesia medications. I remember her saying those words. And then mom also saying, you're hurting her. You don't know how to treat this patient. You need to listen to me. And it was kind of like a, discussion between them.
So were you able to take a history of what was going on here?
I eventually was. At the beginning, I think, my interaction was more, okay, let's calm down. We really need to get her vital signs. I want to, Maya was clearly suffering. So I wanted to make sure I had at least the minimal information I needed so I could choose the right interventions for her.
Okay. And what interventions did you choose? What did you do?
So at that moment, after at least we had some basic vital signs, I recall that we did give her a benzodiazepine to try to just kind of get the anxiety and the nervousness and stress kind of calm down, so we can at least do a physical exam and have more effective communication between the family and me.
Okay. So what's a benzodiazepine?
It's a medication that's a sedative. Mostly it doesn't really take care of pain. Depending on the dose, you can do more for anxiolysis, may take the anxiety down, but if you do enough of it, you can make somebody just kind of go to sleep.
She was asked what kind of complaints she heard Maya voice.
So she just kept saying, it's hurting. She would call out like any other kid to her mother, Mom, please, I'm hurting. The things that developmentally, kind of stuck to me and still after all these years, and she was saying things like, I need my anesthesia medication. I need my medications. She would tell the nurses, give me my medicine. She would say, I need you to push the medicine. I mean, those are things that I have heard between us, in the medical field. And that kind of stuck in my head as a 10-year-old, kind of requesting very specific things. She would say the names of the medications that also kind of stuck in my head a little bit. But, we had the pain team had already been contacted in the ER, and I had also put another call that let them know that she was in the ICU. So I really, they came very promptly. So I really she was suffering. She was clearly suffering. And, while we were getting all our information, I wanted to get her in a place that she was at least a little bit alleviated from that suffering.
Dr. Tepa Sanchez spoke with Maya's mom to learn about Maya's history, the CRPS diagnosis, her past admissions, her trips to the ER, the regular high-dose ketamine treatments, and the week-long trip to Mexico.
She did mention that she was a patient of Dr. Kirkpatrick and Dr. Hannah, and that she would go regularly to get, depending on where her, exacerbation of her pain was, to get these infusions of high doses. She told me all the doses of the ketamine to kind of, in her, kind of explanation was to try to break that pain. She also mentioned that she had been to Mexico for I believe was a week, where they did an infusion of high-dose ketamine, and that she was intubated during the time. And that at this, on our admission, she was asking me to please start those medications, the ketamine at those doses, and that I needed to intubate her. That we had to intubate her and do the whole, kind of a week or whatever, how many days it would require, because that's the only thing that would take her pain away.
She was asked if there were any issues she had with Beata regarding the amount of medication she was requesting.
Then her initial requests were of really high doses. So I don't know if when you mean issues, like more of that discussion that we had, that I was not comfortable given those amount of doses. I had never, gotten anywhere close. And that was definitely out of my wheelhouse. So I did mention to her that I did not feel comfortable doing that I was consulting with the pain team as the anesthesiologists that deal with this type of kind of chronic pain type of patients. So it was a back and forth on the dosing. Like we would come and create a plan, like we're going to start the ketamine I usually start at like 0.5 milligrams per kilo or 1 milligram per kilo, but for different reasons, not specifically for pain. With the pain team, we came up to 3 milligrams per kilo is where we were going to start. The doses that we requested were more like 10 milligrams per kilo. So there was a back and forth on the dosing of what we were going to do.
She said the pain team was taking primary responsibility.
Did you have any exchange with Mrs. Kowalski about her level of stress and Maya's level of stress at that time?
Yes. I recall during that time when we sat down and kind of were able to have more effective communication. She did express how stressed she had been. I believe I also note that on my HMP, on the HPI part. She was saying that this had been, a really rough year for them, and that she had been very stressed. And she did mention that at times she just felt like she just couldn't do it anymore, and that either her and Maya as well were very stressed and thought that, that at times she just wanted to die. She also said, and I put it in quotes, that she just wanted to go to heaven.
Okay. Now, did you offer to assist Mrs. Kowalski about that?
Yes. After that was said, and, we continue our discussion, I asked her if she had a support system that, that we could definitely consult our psychiatry department for Maya, and that with the social work, we can get counseling for her and kind of get her resources at this moment. And she, when I said that, she said, no, well, I'm okay. I'm okay now. I'm not thinking about that right now. So then I told her, I offered, like, if she ever needed, help to try to find resources, or if she needed, if she was having more trouble, that we could help try to find people that could take care of her.
The jurors were allowed to ask questions for clarification. Dr. Tepa Sanchez said Beata made those statements on the first day when Maya was admitted.
Are these observations clearly recorded in the Johns Hopkins All Children's Hospital medical records?
I'm going to quote my note and read. Mother states that she is extremely tired and is very stressed, and at times feels like she wants to die, unquote. She also expressed that when Maya is in so much pain, she has also expressed she wants to go to heaven, unquote.
Then another question from the jury.
Next question. Do you have the document or that documented of the back and forth of the ketamine dosages of comprising the 1 milligram per kilogram to the 3 milligram per kilogram?
I'm going to check my records. From my HPI, I do say she states that at this point she's having a crisis and needs to be placed on an induced medical coma in order to break the pain. And then on my plan, I just state the final doses of what we had agreed on.
Dr. Tepa Sanchez had testified that Maya had used the F word. In her notes, she wrote that Maya was acting aggressively. The Kowalski's attorney challenged her about this on the stand.
That must have been pretty amazing to you that a 10-year-old would drop an F-bomb and other things, right?
I mean, it was surprising, yes.
Okay. How come you didn't put down any of the specifics of that in any of your notes?
I don't tend to put curse words in my notes. I do think at some point, I don't recall where, probably in my H&P, I did say that there was aggressive language.
Well, now you're saying that it involves a 10-year-old little girl talking about F-bombs and so forth. You didn't think that was significant enough to describe in your notes?
Can I have a moment to find it? Okay. It's after the abdomen on the physical exam. Very difficult to examine as patient refuses to be touched and mother does not want us to evaluate further unless she's placed on anesthesia medication. Then neurologic. She's very agitated. Eyes are open with intact extraocular movements. No focal weakness. The next period. Very aggressive with staff. Not able to evaluate deep reflexes. I think I just kind of summarized it on very aggressive with staff just because I don't.
But you said nothing about what you testified here in front of this jury, did you?
I just said very aggressive to staff. And to summarize all that, I don't tend to put specific bad language on my notes.
Really?
It's a document, so I don't.
That's like offensive to you.
It is offensive to me.
And insofar as the amounts of ketamine involved, you have no particular expertise in ketamine, especially at that time, right?
I had expertise, but for different indications. We used it a lot.
Mm-hmm. How many years were you in practice as of this date, October of 2016?
For critical care. So pediatrics, by then I had probably been off residency for about 4 years.
Off residency?
For pediatrics, yes. And then for critical care, that was a year. But I did 3 years of fellowship.
Here's how Maya described what happened when she was brought into the PICU.
When I was transferred to the PICU, I remember my mom came in at some point. The nurses and doctors wanted to put a tube down my nose. And with CRPS, a blood pressure cuff, that hurts. So imagine, like a tube being shoved down your nose into your stomach. And obviously that would have caused so much pain. And I knew my body. I knew I was not going to be able to tolerate that. That is the only time I asked for sedation. I didn't just randomly yell out, I need sedation, like depicted in the medical records. I only asked for sedation when they wanted to do that procedure.
And then were you given sedation before they tried to put this tube down your nose?
I was not. And my mom was actually in the room and she listened to the doctors and didn't demand for sedation. Instead, about I would say 2 or 3 people held me down and tried to get the tube down my nose. That is when I was screaming, crying, and thrashing around. I did not curse at any of the staff. That is a lie. But they were not able to get it down, which I suspected because of the pain.
Were you fairly religious? Did you curse as a matter of course as a religious 10-year-old?
I never really cursed. I always thought it was really bad when people did it.
The following day, on October 8th, 2016, Dr. Tepa Sanchez called Dr. Sally Smith, a child abuse pediatrician. It was a Saturday after her morning rounds of seeing her patients. Dr. Tepa Sanchez was sounding an alarm. And by Monday, the case was officially under investigation. Dr. Sally Smith was the medical director for Pinellas County's Child Protection Team. She wasn't working for all children's in 2016, but she did have staff privileges. Dr. Smith came to believe that Maya's mother, Beata Kowalski, was committing medical child abuse. She explained why in a videotaped deposition that was played during the civil trial.
Upon review of all of the extensive medical records, review of all of the observations of the child in the hospital, review of the, let's say, unconventional treatments, including hyperbaric oxygen treatment and high-dose ketamine treatment repeatedly, it was my opinion that there was ample evidence to support a diagnosis of medical child abuse. And it appeared most likely that Mrs. Kowalski was the primary one who was resulting in, or I don't know what the term is, it's not probably instigating, but initiating or whatever, the child abuse. Perpetrating the child abuse, let's put it that way.
Just the prednisone issues, the stuff we've been going over the last hour. Do you think that was an act of child abuse?
There was an element combined with everything else of child abuse in the prednisone utilization and administration to the child, yes.
Other than this case, have you ever testified in court or by deposition in a case involving CRPS?
No.
In a proffer outside the presence of the jury, Dr. Smith and the Kowalskis' attorney had heated exchanges.
Dr. Smith, before, or let's say right at the start of this in the first part of October, you had a call with Dr. Kirkpatrick, did you not?
I did.
And Dr. Kirkpatrick explained to you that he had been treating Maya Kowalski for CRPS, correct?
He did.
And he told you that statistically speaking, CRPS is often mistaken for conversion or Munchausen by proxy, did he not?
I don't really remember exactly what his words were. I took a few notes from the conversation that I had with him, and I know that there was some general discussion along those lines.
And yet you did not put anything in your report about Dr. Kirkpatrick, did you?
Yes, I believe there's a whole section about his medical records.
Yeah, except for the fact that you did not tell anyone in that report that he had warned you off of going after the Kowalskis.
It's completely irrelevant for a child protection team medical evaluation because that's the whole point of the evaluation and gathering all the records. The problem in these cases is that the treating physicians have not done that. And so the fact that he, who sent her to Mexico for the ketamine coma, told me not to investigate child abuse, it was completely irrelevant to me because my job was to investigate child abuse. So if I had come away from my job saying, I was supposed to do this, but this doctor told me not to, so I'm not doing it, and there's no evidence of anything here, I would not have been doing my job even remotely near a standard of care.
Do you not understand the importance of putting both sides of the story in your report?
The both sides of the story is the responsibility of the various people who are going to present it to the court. My job as the medical director for the child protection team is to do what I need to do to assist the investigators and the detectives and the attorneys that are involved in the case as to whether there is evidence to support a diagnosis of whatever type of child abuse is being assessed. So it's not my responsibility to lay out some whole long argument about what it might be otherwise if I have extensive evidence to support that it's a type of child abuse.
Dr. Smith, you know there wasn't a single child psychologist or child psychiatrist that diagnosed what you were claiming. You're aware of that, right?
That's also irrelevant.
So you are the ultimate decider of medical issues which you have minimal or no training in.
I have extensive training.
The hospital's attorney asked her,
When you spoke with Dr. Kirkpatrick and he warned you off, did he tell you that he had last seen this child 10 months before the conversation?
I honestly don't recall if I already knew that. I might have already known that.
And when you wrote your report, you had the Tampa General Hospital records, the Lurie Children's Hospital records, the All Children's records predating October of 2016, correct?
Correct.
You know, all those hospitalizations with all those specialists that saw this child, did you see any of them suggest that CRPS was the diagnosis?
No, and multiple were experts in complex regional pain syndrome.
In one of the depositions Dr. Smith had given that was played in court, jurors heard her being asked about covert video surveillance.
There was, I believe there was a day or so that there was some videotaping of the child in her hospital room in an attempt to document the amount of movement that she was and the activities that she was undergoing in her room when people weren't present or when doctors weren't present.
Who directed the video surveillance?
I guess I don't know. They have, a setup at the hospital.
Who directed the video surveillance?
I had discussion with the hospitalists. I don't remember exactly which one it was at that point in time about the possible benefit of that activity.
What did you find with the video surveillance?
There were numerous instances during the video which were comparable to numerous observations of the physical therapists, the nurses, the child life staff, the music therapy staff, etc., of the child moving around in bed, putting her feet in normal neutral position, using her upper body, her lower body in various movements that provided concrete evidence in support of all of the observations that were made by numerous hospital staff.
How does any of this indicate child abuse?
How does any of what?
The concrete evidence of her video of Maya Kowalski in her hospital room.
That was related to, she's 10. So as the children get older, there can be a component of the child having been sort of participating in the medical child abuse. One of the ways that this occurred in this case was that the child had very inconsistent patterns of movement and reports of pain in response to certain movements and numerous other observations that were made by the hospital personnel.
Dr. Smith was asked how much involvement she had in Maya's care while she was at the hospital.
I was not a treating physician.
That's not my question. How much involvement did you have in her care?
I had conversations with some doctors.
Did you direct any actions?
I had discussion with several doctors at various points in time regarding things that could be considered to improve Maya's safety and her and the effort to have her have a more effective separation from her mother. There were a lot of times when she was Skyping with her mother, even though she was sheltered in the hospital. And so there were some discussions related to ways to minimize effects on her safety related to that.
Beyond discussions, did you direct any actions?
I don't believe so specifically, no.
At this point, Maya was now separated from her family, held at the hospital while the investigation continued.
Were your mom and dad able to come see you in your room at this time?
At this time, yes.
Okay. Your dad. Okay. And then tell us about the rooms you stayed in during this period of time, October, November, December of 2016. Regular hospital rooms?
So first the emergency room, then the PICU. The most distinguishing thing about the PICU, even though every room kind of has it, it's the circular clock. And I remember that because that's all I looked at for days, and I just heard it tick because I didn't have the strength to watch anything on the TV. And then when I was moved up from the PICU to a different floor, I believe it was 7. I stayed on 7 a lot. I had multiple different rooms, even though their policy is every 30 days you switch a room. I think I stayed there over 90 days, but I had way more than 3 rooms. And these rooms had surveillance cameras. And when I was placed in those rooms with the surveillance cameras, I was told that to not worry about them, they don't work.
So now, if we could, there has been allegations here that you were outside your room 95% of the time. Can you tell the jury whether that's true?
That's not true at all. Most of the time I was in my room. There were times where I went to PT, which I was outside my room, and there was a few occasions where I went to the rec room. But for, I would say, the majority of my time, I was kept in my room.
And did the rooms have the kids that were there, their names on the door or next to the door?
So at one point, I started to get wheeled out into the hallways and whatnot. And that's when I was going to PT or the rec room. Uh-huh. And I noticed something really weird was that all the other rooms on the floor, they had name tags. It would say the patient's name and just the last initial. Whereas with mine, I just had a sheet of paper in there with color-coded stickers. I asked the nurses what the color corresponded to and what that meant and why I didn't have a name, and they would not tell me. I asked multiple nurses, and all of them said, I can't tell you.
Maya testified that at 10 years old, she missed her parents terribly.
Was there a time during this period, this first week or so, when your mom called for you and you did not receive the call but overheard what was said?
Yes. So I remember that my mom was on this phone call, and the person who she was speaking to, a person at the hospital, I'm not sure what role they had, but they claimed that I never asked to speak to my mom. I was doing fine. I was okay in my room. I hadn't had any questions about why my parents weren't allowed to see me. And that infuriated me so much because all I did for days on end was demand to speak to my parents. That's all I wanted to do. And I most certainly wasn't just sitting in my room. I was crying.
Maya said she went to the playroom to do art activities, and another patient, another child named Natalie, struck up a conversation with her. She had made a friend, but the social worker in charge, Kathy Beatty, interrupted her.
Another nurse observed this interaction and quickly told somebody. Next thing I know, Kathy Beatty is in my room saying I'm not to ever speak to a patient again. And that day, Natalie had given me this little present because her mom noticed my parents were never with me. I think they just wanted to comfort me, and I have it in my bag today.
Did they ever give you any reason why you, as a 10-year-old, couldn't just talk to the kid next door, for lack of a better term?
I have no reason. I mean, they didn't give me any reason. And it was heartbreaking because, they had my door open a lot and the blinds were open so I could see other people conversing and interacting. And here I am all alone.
Mm-hmm. Now, were they at this time paying a lot of attention to your symptoms, discussing your symptoms with you?
Even though I told them about my symptoms and I pointed them out, it didn't matter. They kind of just ignored them.
Before we go further, I think what I want to do, if we can pull up 2003-001, the All Children's Health System, a summary of Florida patients' Bill of Rights and Responsibilities, if we could.
The attorney read from the hospital's Bill of Rights. He said she had a right to courtesy and respect, individual dignity, protection of her privacy, a prompt and reasonable response to questions and requests, among others. Some doctors were convinced that Maya had conversion disorder, which is when a person's mental health affects how the brain works and causes real physical symptoms and affects a person's senses. Maya was asked if she was ever given a diagnosis from the doctors at All Children's or ever told what kind of treatment plan they had for her.
So they never told me straight up. They never said, we think you have conversion disorder. They never said, we think your mom has Munchausen by proxy. Instead, they would give me like little clues in the things that they were saying. So, for example, when I expressed to them a symptom or like my pain, they would say, no, you're making it up or it's in your head. And then at one point, the social worker, Kathy Beatty, said that my mom was in a mental institution, making me think that something was wrong with her. And I asked my dad and it turned out to be a lie. So they were trying to even manipulate me into thinking that my mom was sick and therefore making me sick, even though it wasn't true.
Well, as the allegations of Munchausen by proxy, which are that your mom or dad are intentionally trying to keep you sick, did any of the doctors or nurses ever simply ask you about your relationship with your mom and dad?
No, and as a matter of fact, they always told me what went down in my house. Dr. Elliott, he said that my mom was putting me in a coma every single week, and I told him no. But even though I told him no, he wouldn't accept that as an answer.
Did they seem to have their own story they wanted told?
Absolutely, no doubt about that.
Meanwhile, Maya said her physical health deteriorated.
So when I first got in, I was in extremely bad condition because of the relapse. Once the constipation had passed, I did get a little bit better because the pain from the constipation was now gone. But my physical condition as I went on got worse and worse.
By the end, what was their physical condition by the time you finally got out of there?
Well, to paint the picture, I mean, before I went there, you saw me on the walker. Like, I was on my way to walking and being able to stand and bear weight. And then when I left, I couldn't even open a water bottle.
Could you sit up by yourself, hold yourself up by yourself?
No.
Maya accused some of the nurses of trying to force her to move and dance in the hospital bed while they played her favorite music, even though she was in extreme pain. She testified that they were filming her to paint a false narrative that she was healthy and happy to show to the courts. Meanwhile, she said one doctor literally laughed in her face when she tried to explain how she was feeling and what she needed. She said another nurse threatened her.
There was a point where they were moving me up to floor 7. So that called for a bed change. They regularly have to change the sheets and whatnot. It's like policy. But even though I had told her I cannot walk, I cannot stand, I cannot roll, she threatened me. She said, if you don't move right now, what did she say? Or else. That's what she said. Or else. If you don't move right now, or else. I remember the or else. And I just started crying because I'm so scared. Like, my parents aren't here. I have nobody that I trust. And this random lady is threatening me. And I can't even perform the movements that she wants me to. So she yelled at me for quite some time, telling me to roll over. I know you can move. I know you're faking it. Just stand up. We all know. Eventually, she gave up because I could not do what she wanted me to do. She went out in the hallway, grabbed about 3-4 nurses. They lifted me up by the sheet of the bed itself to transfer me, and she dropped my arm really hard in the bed. Now, that's insignificant to most people, but to a person with CRPS, it's like falling on concrete. Like, it hurt so bad. I remember the feeling just in my body. It was so painful, and I just cried. She was just awful.
The Kowalski family's attorney argued to the court that the doctors were convinced that Maya was faking her pain and was trying to outmaneuver the hospital. The attorney called into exhibit one of Maya's medical reports that said her open sores were self-inflicted.
And at 10 years old, I know you're very intelligent for a 10-year-old, but were you equipped to try to outsmart or outthink or whatever these doctors at this point?
I would do that to a doctor. I had an illness, and that's what it was.
Meanwhile, as stated earlier, the doctors were also very suspicious of Maya's mom, Beata. Jack Kowalski, Maya's dad and Beata's husband, was asked to describe Beata to the jury.
Was Beata a kind of a retiring type, or was she more outgoing? How would you describe the personality there?
Beata was always on her feet, always looking to do better, not only for her, but everybody else around her.
An overachiever a bit?
By far.
All right.
Try to keep up with her. It's impossible.
And she was originally from where?
I'm going to say it wrong, but Stola Wola, Poland. Yeah, she came over at the age of 16, I believe.
And did that, from what you saw, influence her insofar as the way she dealt with things? The fact that she had come over prior to Poland becoming free?
I know she told stories how rough it was in Poland. You don't go to Walmart and buy a pillow. You have to make your own pillow, pull the goose feathers out and make your own. Same with groceries, things like that. A lot of it was farming. And so it's a lot rougher. When she came here, she came without speaking English. She learned. And she started out in high school, I believe, in Chicago. And it was difficult for her. But she's very determined. And after high school, she went to college. Her professor said she's not going to make it. And she ended up being the first in her class.
Jack testified how Beata was forward in how she expressed herself, which some people may have found jarring. The Kowalski family attorney suggested that her assertiveness and strength put her in direct combat with the hospital employees.
The jury would probably like to know how Beata was if there was a dispute with an outside person, in this case, these doctors, but just generally, what was she like? Was it hard to get it out of her, or was she direct? What was she?
Beata was unique. When she's right, she's going to prove, yes, she's right. And she is right. A lot of times, we had differences, and I found out I was wrong. I mean, not just saying that.
A lot of husbands find that out regularly.
Yeah, she stands up. If she feels she's right, she's gonna stick to her guns on it.
Under secret surveillance, isolated from other children and missing her parents, Maya testified how the hospital would not allow her to speak in Polish with her mom or see her priest.
I was asking you what the term mamusia means in Polish. What is that?
It means mom.
Right. And what happened when you would speak Polish to your mom, or try to?
So after some time, I was granted privileges to have phone conversations with my mom. And because I didn't have any Polish instruction at the hospital, my only way to maintain my Polish or maybe get better at it was by talking in Polish to my mom. So I would say things like, Dzień dobry, mamusia, jak się masz, which just means, hello, mom, how are you? Or ja kocham cię, which means I love you. And every time I spoke in that language, I was told to stop. I have to speak in English. They would get really worried.
I apologize for the interruption. Same objection. Overruled. You can finish your answer.
But they would always tell me to revert back to English so they could understand.
And so there was also a section in another one of the Patient and Families Have Rights that says you have a right to practice your cultural values spiritual beliefs as long as they don't interfere with the well-being of others. I want to talk for a moment, then that the hospital's right there that you have. I want to talk a little bit about being able to practice as a Catholic in the church, in Johns Hopkins during this period of time. So tell us how often you would have communion, go to church outside of this.
So pre-John Hopkins, I went to church every Sunday, and I went to Sunday school, so I'd get communion once a week.
All right. And once you got in there, what happened? Were you, how are your spiritual needs fulfilled?
They weren't. So I was not allowed to have the communion that my priest from my church at home brought. Eventually, I was able to.
Hang on. Did anybody ever tell you, or did you ever learn why they weren't allowing in holy water, communion, wafers, things like that?
Objection to the they, Your Honor.
The hospital people who were managing you, the nurses, Kathy Beatty, so forth, the people you were communicating with regularly.
Yes.
Did you ever learn from them, or otherwise, if so, we'll explain, why they were keeping communion wafers and holy water and the like away from you?
I know the reason, and it was because they believed my mom was tampering with the wafer or the holy water and putting ketamine in it.
Maya testified that she came to believe that the hospital didn't want her to ever go back to her family.
Was this told to you in some form by Miss Beatty?
She made a lot of comments, especially about my mom. She was the one who came up with the mental institution comment. She also had a lot of ideas of where I should be placed.
All right. And what was she suggesting for you as a place that they would place you?
So I remember this one instance when she came into my room. She asked if she could sit on the end of my bed, and I told her yes. She sat down, and she told me that they were discussing in court the idea of foster care and placing me in a home. She cautioned me, this is word from word what she said, foster care is nothing like it is in the movies. She said that, and then after saying that, she suggested that she take me in and she would be my foster parent.
Social worker Kathy Beatty testified for the defense and denied Maya's allegations on the stand.
Did you at any time ever tell Maya Kowalski that you wanted to be her mother?
No, absolutely not.
Did you ever tell Maya that her mother was in a mental institution?
No.
Did you ever tell her she was never going to go home to her mother?
No.
Did you tell Maya it was all in her head?
No.
Did you ever tell Maya that she couldn't play with other children?
No, in fact, I would see Maya playing down. We had an area of the hospital on the second floor that was the kids' child life playroom, and I would see Maya down there often. I walked back and forth between the two buildings, and I would see Maya down there playing with the other kids.
Throughout the time that Maya was there on the seventh floor, did she have any religious articles in her room?
Yes.
Can you talk about that, please? Tell us what you observed.
Sure. So she had a lot of prayer cards, and she had her rosary. Maya prayed every morning. Some mornings, if I went by the room, she would be doing her prayer cards, and I would knock on the door, and she would say, either I could come in or can I come back later?
What is your faith?
I'm Roman Catholic.
Are you practicing?
I am.
Would you at sometimes pray with Maya?
Yes. Maya was doing a rosary one day, and she was doing the rosary. I can't remember who it was for, but we sat and prayed the rosary together.
One of the social worker's responsibilities was to make sure visitors were escorted to and from Maya's room. DCF was the one that approved the visitors list. Beata Kowalski was not allowed to see her daughter, according to court orders.
Did there come a time when, during that time frame, when Mrs. Kowalski wasn't allowed any contact, where the phone was removed from Maya's room?
Yes.
Okay. And do you recall receiving an email about that?
Yes. Nancy.
Were you the one that removed the phone?
No, Nancy Venn, the social worker that was there on the weekends, removed the phone.
And what was the reason that she removed the phone?
Mrs. Kowalski had made lots of phone calls to Maya on I guess it was a Saturday because that was the day Nancy worked. And there wasn't supposed to be any contact. So the phone was removed.
Now, during this time frame, October 13th to November 10th, make sure I have the date right, I'm pretty sure it's November 10th, was Jack Kowalski entitled to have supervised visits?
Yes.
And who would be supervising those visits?
DCF.
Okay. And during that time, when these supervised visits, who was determining what Mr. Kowalski could and could not bring into the room?
DCF.
Do you recall an instance where Mr. Kowalski wanted to bring in communion and he was not allowed to do that by DCF?
Yes.
Kathy was asked who was tasked with having to tell Maya that her dad had to leave and that Beata couldn't visit. She said she was. She was asked about Maya's reaction.
She was very angry. She was hurt. She was sad. She was crying. But she was also yelling and screaming.
And what do you recall her yelling?
She was calling the medical team and us effing assholes.
Did Mr. Kowalski comply with the information and the request that he had to leave?
He did.
Any issues at all with Mr. Kowalski?
None whatsoever.
Okay.
Kathy said she typically had to be the one to give Maya bad news regarding her situation.
Do you recall an instance where you had to tell Maya that she wasn't going to be able to go home for Christmas?
Yeah.
Go ahead and tell us about that, please.
Maya was really excited about Christmas, and there are a lot of things that go on at the hospital during Christmas. So I got a call or an email from the CPI, I don't remember which. And the CPI asked me to go in and let Maya know that she wasn't going to be able to go home for Christmas. It was a really hard conversation. I went in and explained that to Maya. Maya was so upset. She was crying. She was just devastated. And she was just sobbing. She asked if she could sit in my lap, and I said, sure. I hugged her. She cried for a good 10 minutes or so. And she was mad, and she was saying all kinds of things about wanting to talk to the judge. And that was really it.
What was your intent in having Maya sit on your lap?
Just to provide comfort and support to her at that time.
Is that the only time that you had Maya sit on your lap?
Yes.
On January 5th, 2017, during a FaceTime call, Beata started to speak in Polish with Maya, which Kathy said was forbidden.
Mom started speaking in Polish, and that was part of the rules, is that Mom couldn't speak in Polish to Maya.
Okay, thank you. So what was the intent? Were you intending to try to disturb the call or cause harm?
Oh, no. I just wanted Mom to speak in English so that we were following all the rules that were set up.
The defense also called nurse practitioner Joanna Klink to the stand, who testified that she too had concerns of medical child abuse. She said Maya appeared to show more intense pain symptoms when her mom was there, and that she had seen Maya moving in ways that someone who was in intense pain would not be able to move. She also told the jury that on the day she came into the hospital, Maya said to her, "I'm tired of these lies. My whole life is a lie." She said it struck her as a cry for help. However, she admitted on cross that she never asked Maya to elaborate. 2 days after that interrupted FaceTime call with her mother, Maya lay restless, alone and depressed in her hospital room.
I couldn't sleep. Again, it was a combination of just pain and, my depression from being isolated from my family. So I was up until 2 a.m. And I swear to God, I am not making this up, at 2 a.m, I broke out in tears. I was just crying uncontrollably. And I called the nurse in and I told her, this was a nurse that I actually had a pretty good relationship with. And I told her, I miss my mom. I miss my mom. I love my mom. I want to go home to my mom. Turns out she ended her life.
Was that around that time that
Yeah.
you did? Okay.
That's why I always say that it was really January 8th that she died, not the 7th, because I just have this feeling that it was then.
You felt it.
Mm-hmm.
Maya's father and her brother soon broke the news to her during their hospital visit. Beata had died by suicide. She had been wearing a necklace Maya had given her at the time. And Maya wore that necklace around her neck as she testified at the trial. The judge interrupted Maya's story to give instructions to the jury.
At the time of Beata Kowalski's death, Maya Kowalski was still under the jurisdiction of the dependency court, and a court order remained in effect continuing Maya Kowalski's stay at Johns Hopkins All Children's Hospital. And Johns Hopkins All Children's Hospital could not release Maya Kowalski without a court order. You may continue.
Called into evidence by the Kowalskis' attorneys were text messages between two hospital doctors that occurred after Beata's death. Dr. Tepa Sanchez, who you heard testify earlier in this episode, wrote, "Learned today that ketamine girl's mom committed suicide yesterday. Sorry to say my prediction was correct." "OMG, this is terrible," the other doctor wrote. "I know we did the right thing, but this is really effed up. I feel bad." Dr. Tepa Sanchez wrote, "We definitely did the right thing for the child." "We did," the other doctor wrote. "Well, I really hope she has a chance of a better life now."
Did either of these doctors ever tell you that they thought it was the right thing for you to lose your mother?
Object to the statement of emotion. Overruled.
They never directly one-on-one told me, but the fact that they kept me in the hospital and they regularly told me that, my mom was forcing this on me, they felt that their whole narrative that they were maintaining, they felt that it was better that I was without my mom.
And there on the bottom, did they believe that now life was going to be better for you without your mom in it?
Objection and speculation.
Overruled.
It's sickening, but yes.
All right, I'll ask you now, I asked you a question before about Munchausen by proxy. If you will look down there at the bottom, under the admission diagnosis and then the discharge diagnosis, what is it?
It's fictitious disorder, Stolz-Munchausen syndrome by proxy, and conversion disorder.
All right, now, how long was it before you were able to go home?
I was released on January 13th, and that's why 13 is my lucky number.
Okay, so about, 6 days after your mom?
Correct.
At night in the dark was a welcome home party for Maya when she arrived back to Venice, Florida, after her 3.5-month stay in the hospital. Neighbors had decorated balloons and made signs. It felt so good to be home, Maya testified, but the moment wasn't as perfect as she had dreamed it would be. Her mother wasn't there. Maya was weak and in pain, but she testified about her resolve to not give up. Her mother, now in heaven, was watching over her, she said.
I didn't consider my circumstances. I considered my God. I didn't consider what I didn't have. I considered the resources and tools I had. I had to shift my entire mindset. It was so hard, but I did it.
And you did it without use of any ketamine or any other meds?
I did.
And why not? What was your worry if you did?
I was scared that I was going to end up in the same situation I just got out of.
And so in terms of going to see doctors and so forth during this period to help you, what was your feeling about that?
I didn't want to ever see a medical professional again.
Over the years, Maya's health eventually improved, In middle school, she was president of the choir and president of the National Junior Honor Society. She got her scuba diving certification. She got a job working as a server at Cracker Barrel. She had friends. Still, she had occasional flare-ups, and the pain sometimes came back. She lost weight, and in a photo shown to the jury, she looked frail. Maya testified that she hid her emotions as she dealt with depression. Sometimes she had flashbacks of her time at the hospital. Little things like unscented hand sanitizer, white bed sheets, and grilled cheese sandwiches were still triggering to her. Maya took the stand for a second time during the trial and testified about all the times she missed her mom, like when the family watched their favorite TV shows together, or when she saw her friends bonding with their moms over shopping trips. Now 17 years old, Maya testified that she is looking at colleges and considering Florida State University, Duke, or maybe school in New York. I'm keeping my options open, she said. But she hadn't submitted any applications, and the deadline had already passed. She testified that she doesn't know how to move forward. She feels forever that 10-year-old girl trapped in the hospital. And she notices in photographs she looks just like her mother.
Maya, a difficult topic, but do you have any survivor guilt?
Yes, it's something that is also really difficult to talk about, but I was one of the last people to talk with my mom. And after finding out about her death, the next thing I thought of was, well, maybe if I said something different or...
How did it relate to, do you retrace your steps and your conversations those last few days?
All the time.
And what concerns do you have about things you might have said or not said?
Well, there's a lot of, again, topics off limits, so it was kind of hard to have, emotional and personal conversations with her.
Sure.
In a way, it felt scripted. So I just feel like maybe she thought I didn't care or such, was talking with her, but those moments were so special to me.
This trial was a pretty long one with lots of witnesses, many allegations, and extensive medical records. But after 5 weeks of testimony, it was time for closing arguments.
This is a sympathetic case. Nobody is denying that this is a sympathetic case. In fact, if you didn't feel sympathy in your heart, you wouldn't be human. But the judge has instructed you, and everyone here took an oath, to make sure that their verdict is reached on the law and the evidence and not on sympathy.
The attorney for all children's, Ethan Shapiro, defended the hospital's handling of Maya's case. He said the hospital hadn't imprisoned her, and the doctors believed she was getting dangerous and unnecessary drugs before she arrived there.
Remember, the plaintiff told you that at the end of this admission, this is right before they go to Lurie's, the doctors threw up their hands and said, Mr. Kowalski, we have no idea what's going on. The record says otherwise. The record says even at this early date back in July of 2017, the differential diagnosis of a psychological pain conversion disorder was in the records. Now, again, conversion disorder does not mean that Maya is not feeling real pain. Let's make that very clear. But there's a psychological component to this that does not require ketamine, and we'll talk about that. Now, what we unfortunately start to see a pattern of is what the defense would respectfully suggest is a history of unnecessary medications given at dangerous doses. We did not do anything that caused extreme emotional distress. The idea that this hospital system engaged in some system-wide conspiracy to try to aggravate Beata when all we were trying to do was get Maya on the correct course. Maya talks about some of the abuse that, we're not here to over-dramatize, but it's there. And then she talks about childhood memories and her fear of being told about the ketamine coma and the 50% chance of it killing her. And when you're asking the question, has Maya suffered trauma in her life? The answer is yes. Did all children cause this? The answer is no.
He said the medical staff immediately saw signs of medical abuse and reported it. He pointed to what Joanna Klink had said about Maya saying her whole life was a lie, and how in one of the doctor's notes it had stated that Maya hadn't eaten for 5 days prior to arriving, and that she wasn't allowed. Maya's mom had also made remarks that they may as well consult hospice.
Mom says if we can't get her pain controlled, we may as well consult hospice so she can finally get enough medication and just let her die. The coward's way out is to let them leave. People who care about children do not let that child walk out the door without talking to the family. This is alarming. The idea that there's something improper about our hospital, our employees who care, calling Dr. Smith on a, what do you think? Given what we saw in the ICU, including the statements of talking about terminal hospice, that they're going to pick up the phone and say, hey, you've been at this for a while, what do you think? Would they prefer the standard of care be like just call the abuse hotline every time? This is exactly what you want people to do in this situation.
He said the accusations against Kathy Beatty were false, that because she was a social worker, she was the liaison between DCF and the hospital. She was the bearer of bad news, but that she didn't do anything wrong. He said the hospital didn't either.
When you're looking at the instruction, when they're trying to hold my client liable for a suicide, when all we were trying to do was protect Maya, when all we were trying to do was provide evidence-based approaches for therapies that we believed could heal her.
He pointed out that Maya eventually got better without using ketamine. In their closings, the Kowalski family's attorney, Gregory Anderson, argued the hospital had no accountability, which led to an environment where social worker Kathy Beatty could run wild. He said the hospital ignored Maya's CRPS diagnosis, thus failing her.
Don't you think if there was some sort of psychosomatic condition, the over 50 doctors that saw her beforehand would have found that out? Couldn't they have figured that out? The Johns Hopkins doctors. She'd even been admitted twice before this. I will come back in a moment to what I think really happened on that evening. But there was some confrontation. Something happened that changed everything and caused this hospital to come away with the idea that they had to prove that Maya did not have CRPS, she didn't have pain, and do everything they possibly could to try to convince her, a 10-year-old girl, 11-year-old girl, that she wasn't feeling what she was feeling, and to put the maximum amount of pressure on Beata. I'm not sure who said what, but I'm pretty sure with Beata's personality that what she did was start to question them and say, we were just here 6 days ago, and by the way, we've been coming here. You're supposed to be our hospital. You're supposed to be our doctors. Why are you putting us through this? Why are you questioning everything that I say here? I don't want Maya to have a blood pressure cuff because do you understand about allodynia? Do you understand about how this disease is? I've been coming here for forever. Why don't you people pick up on this? And that ticked them off because she was challenging them.
The jury deliberated for 16 hours and then reached a unanimous verdict. All Children's Hospital was liable for medically kidnapping Maya to the point that it drove her mother to suicide. And then the jury reached another unanimous decision. As punishment, the hospital would have to pay more than $261 million in compensatory and punitive damages to the Kowalski family. In 2018, the Kowalski family had also brought a lawsuit against Dr. Sally Smith, the child abuse pediatrician, the company she worked for, and Kathy Beatty, the social worker. Smith and her company settled their portion of the case for $2.5 million. And there have been other cases where Dr. Smith reportedly got it wrong, The following is from a report that Fox 13 News did. Quote, "There are reports of more than a dozen instances where parents had credible claims of innocence but were accused by Smith of abuse. One even sent to jail because of it. Many times, charges were dropped after other doctors disputed Smith's claims. Among the cases, infants where rare bone disorders were said to be fractures, and rashes seen instead as bruises." According to The Cut, Dr. Smith officially retired in 2023. In an interview with them regarding the cases from the Fox 13 report, Smith said she has evaluated 3,000 cases in her career. Quote, "So 12 cases, she told me, is a pretty small percentage." I'll link that article in the show notes if you're interested in reading it. Meanwhile, All Children's Hospital asked for a new trial on claims of juror bias and misconduct. The judge denied their motion, but in January 2024 ended up lowering the judgment of $261 million by about 20%. The hospital is still required to pay over $213 million to the Kowalski family. And that's all for this episode. This episode was researched and written by Gabrielle Russon. To hear these episodes without the ads and hear additional Court Junkie bonus episodes, please check out my Patreon options at courtjunkie.com/support. Thanks again for listening. Until next time.